Hello, my name's Simon Gower. I'm the Veterinary Director of the Greyhound Board of Great Britain, and I'm here today with Chunk the Greyhound and Dr. Polly Smith to talk to you about the examination of the racing greyhound, looking for early signs of injury that may affect your dog's performance.
The key tips for an examination of a dog is to really make sure you follow a routine all the time. So if you follow a routine, you're less likely to miss anything out. So what we generally do is we start at the front, so it's basically a nose to tail examination of the dog, concentrating on key areas where the common injuries occur.
So before we begin the full clinical examination of the dog, we're going to make sure that our dog is healthy, and to do this we do a visual examination of the head, just making sure that the eyes are nice and bright, no sign of any discharge or any irritation which might be indicated by rub marks around the eyes. Just check the nose is cold and wet, again no discharge. Have a quick look at the gums, are they nice and clean, no sign of bleeding, no sign of dental disease. Come back here. Have a quick smell of the ears, make sure there's no sign of nasty odour which could indicate an ear infection. And have a little feel under the chin here at the lymph glands and the voice box. Any respiratory disease is often typified by a little bit of irritation if you palpate under here. Just a gentle rub is enough.
So once we've examined the head of the dog, then we move down towards the front leg, so starting with the neck, just palpating the muscles of the neck down to the shoulders. The good thing about examining greyhound is that you've got left and right to compare, so it's symmetrical, and it can help you to see what's normal and what's abnormal by comparing the two sides. So what I do first is come down to the muscles around the shoulder. So you've got if you just palpate with your thumbs or your fingers down the muscles at the front of the scapula, the shoulder blade, down the scapular spine, which is the bony spine you can feel here, and then down the back of the shoulder blade. A common point of injury here is the monkey muscle, which you can just palpate down the back, sort of behind the front leg almost, just down the back here. And if there's injury there, the dog may react a little bit, but also we're looking for subtle signs of damage to the muscle, swelling, or any sort of softness in the muscle there. So once we've looked at the monkey muscle, I then work my way down the front leg, just feeling generally down the leg to start with for any obvious lumps and bumps and swellings. And then what I do first is just lift the weight of the dog off that leg and pick the front foot up. So looking first at the foot here, I'm looking at the webbing between the toes and then working my way through each toe individually, looking for any pain there and also any instability in the toes at all or any swelling. So working down each of the toe bones and then flexing each toe in turn. So I'll do that for all the toes and then I will flex all the toes together. All right, good boy, good boy. And then next looking at the metacarpal area here. And this is an area where particularly in young dogs you can get microfractures, which are basically like shin splints in dogs. So what we're looking here is for soreness, and I work my way again, putting pressure on each of the metacarpals in turn from the bottom up towards the wrist. So go through each of those, and also looking here for any flexor tendon swellings, which is what you tend to see those on the back of this part of the metacarpals. Okay, another thing to do here is just to rotate the metacarpals, and that will cause discomfort in the dog if there are any sort of shin splints there. Okay, so once that's all fine, we move on to the stopper bone. Again, another common site of injury, and what I do here is just with the wrist flexed, is just move the stopper bone basically like a joystick side to side, up and down, okay, and then gently flexing the wrist. Now you don't want to put too much pressure on the wrist, otherwise you will hurt even a dog with no injury. So just gentle pressure to flex the wrist. And while that's in a flexed position, you can also place some pressure here, because this is an area where we can get small chip fractures. So just on the front of the wrist, where the radius comes down, you can just press the end there, looking for any chip fractures. Good boy, Chunk. Okay, then I'll just work my way up the main bones of the leg, looking for areas of discomfort there in the bone, and also the flexor carpi ulnaris, FCU tendon. Just run your fingers down. That should feel nice and tight and smooth. So looking for any lumps, bumps, fluid swellings there. And also in the point here, above the stopper bone, where you can get swelling if there's any damage to the bones there. Also, in examining the front leg, you want to just check there's no discomfort when you're stretching, extending the joints forward. So extend the shoulder and the elbow, and then flex the shoulder and the elbow up like that, and then extend the elbow back. Okay, all of this should be done gently and not putting too much pressure on the dog. So once I've finished looking at the front leg and I'm happy with that, I'll then move on towards the back leg. So starting from where I was at the front and then working my way down, just feeling the back muscles, checking the dog's comfortable with that and you can't feel anything to worry about. Now as you go down the back, you'll naturally then come to this triangular muscle here, which is the TFL. That's an important muscle to feel. And if this muscle is injured, the dog will be quite sensitive to that. It's quite a painful muscle. So just very gentle palpation of the TFL muscle with your thumbs like this, and you should be able to feel any swelling or discomfort or any changes in the muscle if there's an injury there. Moving then forward from the TFL, just then come to the whip muscle, which just runs down. Again, very gentle palpation here. They can be quite sore if you pull down on this muscle. So just gently palpating down the length of the muscle, looking for any swelling or any changes there. Okay, so once I'm happy with that, I'll then move round to the back and look at the gracilis muscles. Now these are really important acceleration muscles. And again, we've got symmetry to help us here, so you can just stand back and compare the two sides, looking for any swelling or changes in shape over the gracilis. And when you feel that, it should be just a nice, hard, smooth muscle and a sort of smooth contour going round and down onto the leg. Below that is then the calf muscle, which you can just follow down from the gracilis, feeling the calf and then down onto the Achilles tendon, looking in just the same way as I did for the FCU tendon in front, just looking for any lumps, bumps or changes in shape down that tendon. Okay, then what I do, just the same as the front leg, I just take the weight of the dog off the back leg and lift it up, looking at the underside of the foot. So here I'm looking in the webbing, looking for any cuts or injuries to the web area, and then just going through each of the toes, so looking at the nails, the pads, and up each length of each toe. I then flex each of the toes back like that, and then a little bit of rotation on those as well, checking for any instability or discomfort. And as for the metacarpals in front, the metatarsals just the same way, working way up each of these individually between your thumb and your finger, looking for any discomfort, swelling or instability in those bones. I then get to the main hock bone, so the calcaneus, give that a little wiggle to see whether there's any instability there. That's all strong and fine. And then looking up the inside of the hock, where the central tarsal bone is, that's just a little bone on the inside of the hock, and if you just place thumb pressure over the inside, looking again for any discomfort there. Good boy, Chunk. Good boy. So the next step is to look again at the joints and look at the range of movement in the joints. So just picking the leg up again, and I just flexing up both the hock and the stifle, just holding those, not too much pressure and not bouncing the joints, just holding them to see that the dog's got good range of motion. I then allow the dog to stand back down, and he should take his weight straight onto that foot, take his full weight straight onto the foot again. So once I've flexed them up, I then extend the stifle and the hip back. Okay, I'm not going to take Chunk's hip back too far. He's not keen on me doing that. Some dogs are just reluctant to stretch the hip right out, but it could also indicate discomfort in possibly the TFL or the whip, but also up in the groin area, so that's worth looking into more if they are reluctant to stretch their hip back. Okay, so once I've finished examining one back leg, I'll then move round and do exactly the same thing on the other side as I've shown you in the front and the back, going around the whole dog in a methodical way.
Thank you, Polly. That was really helpful. What we've run through today is the basic examination of a racing greyhound. Some key points to remember. Always follow a routine, that way you're not going to miss something. So start at the nose and work right the way through to the tail. Remember your left and right. If you're not certain about something, check the other side. If there's a difference in the two, then there's probably something wrong. And thirdly, and probably most importantly, always seek veterinary advice. This is a basic examination that you can carry out at the kennels, but if you're concerned about your dog or any injury, take it straight to a vet and get a thorough examination. Thanks to Chunk and to Polly